When you put your baby down to sleep, place him on his back every time. Studies have shown increased incidence of sudden infant death syndrome, also known as SIDS, in infants who sleep on their stomachs. Since the American Academy of Pediatrics started the Back to Sleep campaign in 1994, cases of SIDS have gone down approximately 50%. In addition to placing babies on their backs to sleep, you should also do the following to help reduce the risk of SIDS. Remove blankets, quilts, pillows, toys, or anything else in the crib before placing your baby in it. Many organizations, including the American Academy of Pediatrics and the Consumer Product Safety Commission, caution against the use of crib bumper pads. Just like a pillow or thick blanket, crib bumper pads can restrict a baby's breathing if the bumper is next to the baby's nose or mouth. Remove crib bumper pads from your crib. Always make sure your baby sleeps on a firm mattress, made especially for a crib or bassinet. Never use a pillow, waterbed, adult bed, couch, sheepskin, comforter, or other soft surface. Use fitted sheets, especially made for the crib or bassinet, which for safety reasons should fit tightly. Make sure your baby does not get too warm. He should not feel sweaty or hot to the touch. Keep the room at a temperature that feels comfortable to an adult in a short-sleeved shirt. If you are concerned that your baby might get cold, use a blanket sleeper instead of a blanket. Research indicates an association between pacifier use and a reduced risk of SIDS, so the American Academy of Pediatrics recommends the use of pacifiers at nap time and bedtime throughout the first year of life. It is recommended that pacifier introduction for breastfed infants be delayed until 1 month of age to ensure that breastfeeding is firmly established. If the pacifier falls out of your baby's mouth during sleep, don't replace it. Also, don't force the pacifier if your baby refuses it. Swaddling has been shown to be beneficial for babies, especially preterm babies. Swaddling can result in longer periods of sleep and reduce the amount of time your baby cries. Swaddling can also help to support baby's neurological development. Should you choose to swaddle your baby, safe swaddles have been developed that prevent your baby from breaking out of the swaddle. Breaking out of the swaddle would result in a loose blanket that is a risk for sudden infant death syndrome. Bed sharing is not recommended during sleep. Infants may be brought into the bed for nursing or comforting, but should be returned to their own crib or bassinet when the parent is ready to return to sleep. Do not allow your baby to be exposed to secondhand smoke. In fact, do not allow smoking in your home. Secondhand smoke increases the risk of SIDS. If you must smoke, do so outside and away from your baby. Studies show that using a low-speed ceiling fan in addition to placing your baby on their back can further help reduce the risk of SIDS. Tell everyone who cares for your baby, including grandparents, friends, and babysitters, to place your baby on his back every time he goes to sleep. The recommendation that babies sleep on their backs may not apply to babies who have certain medical conditions. Your baby's doctor can advise you on which position is best for your baby.